Today, India represents the largest democracy in the world. With a seamless picture of unity in diversity, unparalleled anywhere else. One of the many beautiful states in India is Jharkhand, where the past and the present exist in harmony. Amongst the few important and distinct indicators that reflect a country's development is its public health. A society's well-being is often related to the health of its people. The health and well-being of all its citizens is crucial to its existence. However, a large percentage of India's rural population has poor access to quality healthcare services. The government is working hard to change this with assistance from development partners. Various programs are being run to ensure better maternal health, lower infant mortality rates, and immunization for every child. At the forefront of this effort is USAID. Technical assistance from USAID aims at improving lives and livelihoods in the developing world. Maternal and Child Health Integrated Program, or MCHIP, the USAID Bureau for Global Health's flagship program that supports governments and local agencies with technical assistance for improving the functioning and reach of immunization services. MCHIP integrates programs and services to improve maternal, newborn and child health, immunization, and family planning programs. The primary focus is to reach the unreached, improving the functioning and maintaining of the facilities and scaling evidence-based innovations. Often services and programs are integrated to maximize the reach of essential health services.
MCHIP chose to work in low-performing areas. So it started working in 5 low-performing districts of UP and Jharkhand, state level and the district level. MCHIP was involved in program implementation, monitoring, reviews, and also one of the important things that MCHIP did was to be giving some of the best practices and also including some job aids and also some of the tools that will be useful for the health workers.
Immunization is the most cost-effective of all public health interventions and has had a significant impact on the morbidity and mortality of children. However, there are many underlying obstacles that come in the way of achieving optimal quality coverage. With poor vaccine, cold chain and logistics management, data and coverage issues, and improper microplanning and immunization safety issues, the process is severely affected. To overcome these, a strong and effective mechanism is needed. This is what the MCHIP-supported RAPID is accomplishing.
Over the years, India has improved a lot in immunization program. There have been improvement in the capacity building of the workers as well as cold chain equipments and many other things. If we review the program, we come to see that there are still many issues. In the supply side issues, if you see, there are issues of vacancy of health staff, poor micro planning, weak training and capacity building issues, poor review mechanism. In the demand side issues, we find that the community is not properly aware when to come for the vaccination, where to come for the vaccination, and at times it has been seen that they are afraid of vaccination. The community is not aware what are the normal side effects which happen and which they are apprehensive of. So these issues, when they are creating low coverage in these areas, we have to come up with some innovative approaches. One is RAPID. It's a supportive supervision mechanism which strengthens the implementation of the specific activity at the facility level. MCHIP has been doing these activities in specific areas of Jharkhand and UP, and we have come up with good results.
RAPID begins with the selection of a target district. In this case, the district of Saraikela Kharsaba in Jharkhand. This selection was based on the performance of the district, the availability of the resources, and the state government's buy-in.
MCHIP, being one of our key partners in maternal and child health, has contributed a lot in improving the coverage and quality. In a way, from 8.8%, Jharkhand has gone up to almost 70% the evaluated coverage in routine immunization, which MCHIP had the main role in improving this coverage with quality.
Next is the planning and organizing of an orientation and training workshop. Sample budgets, standard tools and guidelines help in organizing an effective training session. We will follow the process of RAPID in Saraikela Kharsawa. On day one of the workshop, MCHIP's trainers introduce themselves and RAPID to the participants and the supervisors, that include senior district health officials, medical officers, program management staff and cold chain handlers. Here, Dr. K.K. Sehgal, who is the district RCH officer, is attending and facilitating the training. The trainers explain the purpose of RAPID, the use of checklists, the importance of on-the-job training and supportive supervision. The checklists will act as an important tool in the evaluation of a facility. Job aids, photographs, presentations, charts and films explain in detail the correct processes and best practices. A detailed plan of the visits, including the formation of teams and deployment of vehicles, is prepared. On the second day, the participants travel to the field along with the trainers for a hands-on training exercise.
हम लोगों को सर एक चीज फील्ड में हम सभी लोगों को सबसे ज्यादा जो ध्यान देनी है, जिस बात पे सबसे ज्यादा जोर देना है.
Dr. Sehgal and his team members are being trained by Dr. Gunjan Taneja of MCHIP.
Supportive supervision हम लोग कर रहे हैं. जो गलतियां.
What follows is a detailed demonstration on the use of the checklists to evaluate the performance of various procedures and practices like program management, which include microplanning, reporting and recording. The correct procedures involved in immunization, waste disposal, cold chain management and reporting are shown along with guidelines on evaluation of these areas. Ready for the first round of RAPID, Dr. Sehgal makes preparations and plans his visit to the field. On the third day, he travels to the Community Health Center at Chandel and evaluates program management. He ensures that the facility in charge is filling a duplicate checklist along with him.
इसके साथ साथ हमको एक ENM का रोस्टर जो है वो करना है. अच्छा, ये ENM का रोस्टर हो गया. के साथ साथ आपका कैचमेंट एरिया का मैप आपका यहाँ अवेलेबल है कि नहीं? जी सर, इसमें लगा हुआ है सर, देखा जा सकता है. कैचमेंट एरिया का आपका जो है पूरा मैप बना हुआ है ना. RI का जो एक कार्य योजना जो है, वर्क प्लान, वो वाला जो है आपके पास में देखा जाए सर. तो ये ठीक है, बिल्कुल यही है. इसको कंप्लीट आप जो है ना कर लें.
He spends time in the facility working with the staff, understanding their concerns, providing on-job orientations and on-site corrections.
रिकॉर्ड बुक देखना चाहेंगे आपका? ये है सर. ठीक है. तो इसके साथ साथ हमको वैक्सीन जरा दिखाइए तो कोई कैसे वैक्सीन आपने रखी हुई है. डिप्थीरिया का परटूसिस का है, VDM है. जी सर, बहुत अच्छा. IRR में आप लोग थर्मामीटर कहाँ रखते हैं? जी सर, है, देखा जा सकता है. टेम्परेचर भी इसमें ठीक है. आपको दो तीन बातें हम बताना चाह रहे हैं. पहले तो जितने डिफ्रीजर्स और ILR हैं, इनके नीचे जो है वुडन का जो है ब्लॉक देके इसको हाई अप करेंगे और उसी पर रखेंगे. डिस्टेंस ठीक है, और थोड़ा 2-4 सेंटीमीटर वाल सीधा आ जाए. ठीक है. सेकंड, ये स्टेबलाइजर्स हैं, इनको वाल पर एक जो है आप बोर्ड फिक्स करके एंगल देते हुए और उसके ऊपर में रखेंगे. जी सर, ये 2 पॉइंट का ध्यान रखेंगे. तीसरा, हम देख रहे हैं कि ये जो विंडोज हैं, डायरेक्ट सनलाइट आ रही है, देख रहे हैं? जी सर. तो इसमें डार्क कर्टन का व्यवस्था आप करेंगे, इसको प्रोवाइड कर जाएगा सर. हम समझते हैं कि ये काम आप जल्दी कर लें कि नेक्स्ट विजिट में हम जब आएँ तो हमको पॉजिटिव लगा हुआ मिलेगा सर. ठीक है.
He then discusses his findings with the staff of the Community Health Center and gives them a detailed feedback. He commends them on their performance and informs them about the areas of improvement. Dr. Sehgal now travels to an outreach session site and evaluates immunization practices along with counseling the staff on best practices.
तो वैक्सीन कैरियर आपका जरा इसको ऊपर लाओ। सारी वैक्सीन जो है जीपर बैग में है, ठीक है। सारी वैक्सीन लेके आए ना? ठीक है। तो आप जो है ये आइस पैक के बाहर आपने रखा हुआ है वैक्सीन रखने के लिए, है ना? तो इस वैक्सीन में आपने ये क्या चीज़ का वैक्सीन? पोलियो तो ठीक रखे हैं, हेपेटाइटिस बी है, ये कौन सी वैक्सीन? ये डीपीटी। तो ये आप ये ना सिस्टर याद रखिएगा, ये जो है आइस पैक के ऊपर नहीं रहेंगे, है ना? क्योंकि ये जो है फ्रोजन आइस हो सकती है उस वैक्सीन का, इसलिए जो है इस 2 ट्यूब्स में हम लोग आइस पैक के ऊपर पोलियो, बीसीजी और मीजल्स ही रख सकते हैं, है ना? ठीक है। ये रेड बैग ब्लैक बैग जो है इसको आप ओपन करके या वेस्ट डिस्पोजल डालोगे। अच्छा पहले ये बताओ तुम्हारा एमसीपी रजिस्टर कहाँ है?
सर अपडेट नहीं होने के कारण वो नहीं है।
नहीं, तो आपको सेशन सेट पर एमसीपी रजिस्टर जो है साथ में रखना है और उसी में फाइनल लिखना है सारी चीज़, ठीक है? अच्छा।
The next day, data collected by Dr. Sehgal and many others who visited the facilities is recorded. Graphs and reports are generated. A dissemination meeting is then held where Dr. Sehgal and others share their experiences and findings.
जो रिजल्ट थे वो हेल्थ फैसिलिटी के हिसाब से है, सीएससी के हिसाब से है और सेशन के हिसाब से।
A plan of action is prepared where responsibilities and tasks are assigned to address the various issues found in these visits. During these 6 months, repeated visits are made by the health staff and program officers to ensure and monitor the progress made. 6 months later, Dr. Renu Bakla, like many other designated supervisors, travels to the same district for a follow-up visit. She checks all the program components with the help of the same checklists.
वैक्सीन आपके सारे हैं सर?
हाँ जी हाँ।
किस तरह रखा हुआ यह भी देखना चाहेंगे। ये सारे आप डीप फ्रीजर और आइलैंड लकड़ी के भी स्लैब पे रखा हुआ है सर?
जी हाँ मैडम। ये यहाँ पर है।
आपका पिछला रिकॉर्ड जो देखने से पता चला आपका कटिंग नहीं था, तो इस बार टेम्परेचर रिकॉर्ड के लिए थर्मामीटर कहाँ रखा है?
हाँ मैडम इसी में है, देखा जा सकता है।
She then visits a randomly selected outreach site in the district. State-level officers also participate in the supervisory process.
रैपिड जो है हर एक 6 महीने में किया जाता है। ये एक सपोर्टिव सुपरविजन का एक तरीका है जिसमें कि एक बार लोग जाते हैं और सुपरवाइज करते हैं और देखते हैं कि क्या कमियां हैं या क्या खामियां हैं उनको इम्यूनाइजेशन करने में, और उनको बताते हैं कि कैसे बेहतर तरीके से किया जाता है। रैपिड के द्वारा हम देख रहे हैं कि हमारे इम्यूनाइजेशन के कवरेज में लगातार वृद्धि हो रही है।
Dr. Bakla then compares her findings with that of Dr. Sehgal and discusses the same with the CHC staff. The progress is evident. For instance, in the cold chain storage, wooden blocks have been placed under the freezers and ILRs. Stabilizers are now wall-mounted. Dark curtains on the windows block sunlight. Best practices and procedures are followed. The process is repeated till satisfactory quality improvement is achieved. Over the past years, the impact of RAPID in the MCHIP intervention districts has been remarkable. After seeing the results, the government of Jharkhand decided to conduct RAPID in all its districts using the state's own funds, while in Uttar Pradesh, UNICEF decided to implement the approach in 32 of the 75 districts. The government of Haryana scaled up the intervention in all the districts through their own resources. RAPID was also demonstrated in the states of Madhya Pradesh, Odisha, Uttarakhand and Rajasthan. RAPID has been shared internationally in Tanzania, Kenya, Madagascar, Uganda, Nigeria and the DRC.
We have also developed 16 varieties of job aids which help the health worker at the cold chain point as well as at the immunization center site. These specific activities have also been enrolled in the immunization handbook of medical officers as well as the health workers. In addition to that, we have also developed softwares for micro-planning, for JE campaigns and for measles catch-up campaigns. MCHIP has been helping the community and the medical officers in the supportive supervision mechanism, and the areas where MCHIP has been doing, the pilots have been successful and they have been scaled up in specific areas in the same states as well as other states. We hope with these specific mechanisms and these specific operational areas, other states and other countries can also be benefited, and we wish to share our findings with all of you so that you can use it as per the requirement.
The rapid approach is facilitating quality improvement of immunization, service delivery, and problem solving with the health staff. It can also be used in the areas of newborn care and family planning. Rapid is taking quality healthcare to the farthest of places. Rapid is ensuring a healthy future for millions. Rapid is replicable. Rapid is sustainable. Rapid is scalable. Rapid is helping save lives.